The loading dock door was supposed to be locked. It never was, not really. The chain was old, the padlock was for show, and everyone who worked at Ridgeview Medical Center knew it, and nobody had ever done anything about it because nothing had ever happened. That changed on a Tuesday afternoon in March. Nurse Priya Okonkwo-Reyes was checking a chart when the doors to the trauma ward sealed shut with a sound like a held breath. She looked up. A man stood near the nurse's station, tall, thin, wearing a gray hoodie 2 sizes too big for him. He had a gun in his hand, and his hand was shaking. For 1 full second, nobody moved. Then someone dropped a tray, and the sound of metal hitting tile broke the silence, and the screaming started. Priya did not scream. She had spent 3 years overseas as an army combat nurse before she ever set foot in a civilian hospital. That kind of training does not disappear once you take off the uniform. It settles somewhere behind your ribs and waits. Her mind did what it always did in moments like this. It counted. 2 exits. 1 at the far end of the hallway, 1 behind the supply closet. 12 people on the floor, counting patients, staff, and 1 visitor who had come to see his mother after her surgery. 1 gunman, 1 weapon. A pistol, held with an unsteady grip, the kind of grip that told her more than his words did. "Everybody down. Now!" the man shouted. His voice cracked in the middle of the sentence, like a boy's voice does before it settles into a man's. People dropped to the floor. Priya lowered herself carefully, keeping her eyes on him the whole time, not in a way that looked like a challenge, but in a way that looked like calm. She had learned long ago that calm can be its own kind of language. It tells a frightened person that the room is not about to explode. "Phones, all of them. Now," he said, and people began sliding their phones across the floor toward him. Priya slid hers too. He gathered them with 1 hand, keeping the gun in the other, and dropped them into a plastic bin by the door. His eyes moved constantly, darting from face to face, like he expected someone to lunge at him. Nobody did. Not yet. 20 minutes passed like that. The ward was quiet except for the low beeping of monitors and the occasional whimper from a frightened patient. Priya kept her breathing even and slow, in through the nose, out through the mouth, a rhythm she had practiced so many times in far worse places that it no longer felt like an effort. It felt like default. She studied him without looking like she was studying him. His shoes were untied. His hoodie had a tear near the cuff. His eyes were red, not from anger, but from crying, or from not sleeping, or both. His hands trembled every few minutes, not from adrenaline, she thought, but from exhaustion. He was not a soldier. He was not trained. He was someone who had run out of every other option and ended up here, in a hospital hallway, holding the only thing he had left that made people listen to him. That did not make him safe. It made him unpredictable in a different way. At 2:47 in the afternoon, the man in bed 6 began to seize. His name was Walter Higgins. He was 68 years old, 3 days out from a major surgery, and his blood pressure had been unstable since that morning. Priya had already flagged him twice for the attending physician. Now his whole body was shaking, his monitor was screaming a high, sharp alarm, and his lips were beginning to turn a shade of blue that no nurse ever wants to see. The gunman spun toward the sound. "Stay down! Everyone stay down!" Priya stood up. Someone near her gasped. A young nursing assistant grabbed for her sleeve, trying to pull her back to the floor, but Priya was already moving forward, slow and steady, her hands open at her sides. "He will die in 4 minutes if nobody helps him," she said. Her voice was flat, not pleading, not frightened. Just true. The gun swung toward her chest. She looked at it the way she might look at a fire alarm going off during a drill. Something to acknowledge, not something to let stop her. "I said stay down," the man said, but his voice had lost some of its edge. It sounded more like a question now than an order. "I am a nurse," Priya said. "That man is going to stop breathing. I need 4 minutes with him. That is all I am asking." The seconds stretched out. The gun did not lower, but it did not fire either. His hand shook harder now, and Priya understood something in that moment that she had understood before. In places far from this hospital, in situations far more dangerous than this one, a frightened man holding a weapon is not the same as a killer. Fear and violence can look the same from the outside, but they do not always mean the same thing. "Go," he said finally, stepping back half a pace. "Go, but don't try anything." Priya did not run. Running would have looked like an escape attempt, and she did not want him to feel like anything was being taken from him. She walked, quickly but calmly, to bed 6, and her hands went to work the moment she arrived, checking his airway, turning his head to the side, watching the monitor, counting seconds in her mind without even trying. Behind her, the room held its breath along with her. 30 seconds. Walter's body was still shaking, but his color was beginning to shift back from blue toward pink. Priya kept one hand steady on his shoulder and reached with the other for the call button, praying silently that someone outside the sealed ward was watching the security feed and understood what she needed. A full minute, the seizure began to ease. Priya adjusted the IV line, checked his pulse again, and spoke to him in a low, even voice, the same voice she used with every frightened patient, gunman or no gunman in the room. "You're okay, Walter. I've got you. Just breathe with me." 2 minutes, his body stopped shaking. His breathing steadied into something that resembled normal. Priya looked over her shoulder at the man with the gun. He was watching her, and something in his face had changed. The tightness around his eyes had loosened just slightly. He looked, for a moment, less like a threat, and more like a boy standing outside his depth in cold water. "Is he going to be okay?" the man asked. It was the first thing he had said that did not sound like an order. "He will be, if I can keep working," Priya said. "May I check on the others?" He hesitated, then he nodded. For the next hour, Priya moved carefully between patients, always in full view, always announcing what she was doing before she did it, careful never to make a sudden movement that might spook him. She checked blood pressure. She adjusted a drip. She spoke softly to a woman whose hands would not stop shaking, and she asked the gunman, quietly, if she could walk one of the older patients to the restroom. He allowed it. Then he allowed another. Slowly, without either of them naming it directly, something in the room had begun to shift. Priya was no longer only a hostage. She had become, in his mind, someone who was helping him carry a weight he had not expected to be this heavy. An hour and a half into the standoff, he began to talk. He told her, without being asked, that his sister had been in a hospital ward just like this one, 2 years earlier, that she had not made it out, that he had not been able to pay for the care she needed, and that something in him had broken quietly in the months since, in a way nobody around him seemed to notice or care about. Priya listened without interrupting. She did not flinch at anything he said, and she did not try to fix it with quick comfort or empty words. She simply listened, the way she had learned to listen to soldiers who came back from missions with wounds nobody could see. "I'm sorry about your sister," she said finally. "That kind of loss doesn't go away easily." He looked down at the gun in his hand, as if seeing it for the first time in hours. "I didn't want to hurt anyone," he said. "I just wanted someone to listen. Nobody listens until you scare them." "I'm listening now," Priya said. "And nobody in this room wants to see this end badly. Least of all me." Outside, though nobody inside the ward could see it, a negotiator had been on a phone line for the last 40 minutes, patched through a landline in the nurses' station that the gunman had allowed to remain connected, almost as if some part of him wanted a way out, even while another part of him kept a white-knuckled grip on the gun. Priya did not know exactly what words passed between the negotiator and the man holding her ward captive. She only knew that at 4:12 in the afternoon, he set the gun down on the counter beside the nurses' station and placed both hands flat on the surface, palms down, fingers spread, in the universal gesture of surrender. "It's over," he said quietly, to no one and everyone at once. The doors opened 4 minutes later. A team in tactical gear moved through quickly, calmly, guiding him away with more gentleness than anyone expected, given what the last 2 hours had been. Priya did not watch him go. She was already back at Walter's bedside, checking his vitals one more time, making sure the crisis in the room did not distract from the smaller crises still needing her attention. The hospital was full of reporters within the hour. Cameras lined the parking lot. A local news anchor asked if anyone from inside the ward would be willing to speak about what had happened. Priya declined the interview twice. On the third request, she agreed, only because the hospital's chief of surgery asked her personally, saying it might help other staff members feel less afraid about what they had all just lived through. She stood in front of the cameras for less than 2 minutes. "I did what any nurse would do," she said. "There was a patient who needed help. I helped him. Everything else was just staying calm long enough to get through it." A reporter asked her if she had been afraid. "Of course," she said, "but fear doesn't have to be loud. Sometimes, it just sits quietly next to you while you keep doing your job." She did not mention her years overseas. She did not mention the sister the gunman had lost, or the 4 seconds of hesitation that had let her cross the room to save Walter's life, or the quiet count of exits she had been running in the back of her mind from the very first second the doors sealed shut. Some things, she believed, were not meant for cameras. They belonged only to the people who had lived through them together. By evening, the trauma ward had been cleared, cleaned, and reopened. Walter Higgins was recovering steadily in a private room down the hall, already asking the nursing staff when he could go home. The young nursing assistant who had grabbed Priya's sleeve earlier that day found her in the break room and hugged her without a word, holding on a little longer than either of them expected. Priya still had 6 hours left before her next shift began. She used part of that time to sit quietly in her car in the hospital parking lot, watching the evening light fade slowly behind the building, letting her hands finally shake the way they had refused to shake all afternoon. Then she went home, made a cup of tea, and slept. The next morning, she returned to work exactly on time, as she always did. She checked her patients' charts. She adjusted IV drips. She spoke gently to frightened people in a voice built from years of practice, a voice that had, only 1 day earlier, kept an entire trauma ward from becoming something far worse than a headline. Nobody watching her move quietly between beds that morning would have guessed what she had done the day before. That was, in its own way, exactly how she liked it. Some kinds of strength are loud enough to make the news. Others simply keep showing up for the next shift, and the one after that, long after the cameras have gone home.